quick and easy set of instructions for the person who's facing the overdose. Very often when the adrenaline sets in, your memory kind of gets all flustered. So it's quick and easy pictures and keynotes of what to do first. Each person who receives a kit will be trained in how to use naloxone. And in doing the training, we use the same kind of needles so that they can get used to it. It's naloxone. This one is water. So we don't waste any naloxone training people. There's a little card inside. As you can see, these kits are numbered. So we're going to trace these kits and see where they were used, to try to see how they were used, so we can continue to build on best ideas from the people who use it, what works better, what works best. So it'll be evolving so that it better meets the needs of the individuals. So it has the kit number, when it was issued, the date the naloxone expires. It's really important to note that when we distribute naloxone, it has a 2-year shelf life. So people have to be aware that it will expire after 2 years, and it's written on their card as well. Once people use their kit, they can return to where they got it in the first place, but if they've moved somewhere else in the province, they can simply call 811 and find out where the nearest distribution point is, so they won't have to travel across the province to get their kit refilled. We provide these alcohol wipes, not for the purpose that you would think, because naloxone is an emergency approach. We don't wipe the skin. We go right through clothes, just like an EpiPen, so that it will take effect as fast as it can. So we include these for snapping the vial, so you don't cut yourself. You just wrap it around there, and I'll do it in a second. There's a breathing apparatus to put over the individual's mouth, a pair of gloves if you have the time and inclination, and 2 vanishing point syringes. The most important thing about this kit, besides the naloxone itself, is the fact that the tip disappears once it's fully deployed, so there's no risk at all of an accidental needle stick when you use this type of needle. So if there were a person in overdose right now, the instructions are to shout and shake. So you would take the individual, shout their names, shake them, see if they wake up. A second test is to take your knuckles and rub it really vigorously on the breastbone, or across the top of the lips. Rub with your knuckles really hard. And if you try it, you'll see that really hurts. So if a person is unconscious, they will not respond to that. So then you want to check and make sure their throat or their mouth doesn't have anything in it. So you get the individual, you lie them on their side, and put your finger in their mouth and make sure it's clear, and roll them back on their backs, and then give them 2 big breaths of air. Once that's done, you should call 911. Before you do that, or as soon as you can, if there's another person there, ask them to call 911. And the beauty of everybody having cell phones now is that you can leave the phone on, and 911 will stay on the line with you and help you if you're having any problems. The next thing is to inject the naloxone. So you have to open the syringe. Now, as you can see, the plunger is sticking up just a little tiny bit. And it's a nice big needle. It's a 25 gauge needle because it's designed to go right through clothes, jeans, heavy materials. And so, let me show that. Okay, so you take your naloxone, snap it away from you, and take the syringe and draw up everything that's in the vial. Try not to touch the bottom of the vial. Just Just touching the bottom would probably dull the needle a bit. You don't have to worry about a lot of water, air in there because it's going into muscle. So right into the shoulder, the thigh, or the buttock is the best place, the nice big muscle, and you just stick it in on a 90-degree angle and then inject. There was a little click at the end of that. Ooh. And the needle has disappeared right up inside. You have to stay with the individual. The naloxone may not work for a few minutes. Usually in about 3 to 5 minutes, the person will start to wake up. If they don't, our kits have a second vial of naloxone. While you're waiting for them to come around, it's a good time to, give them some more breaths. Maybe every 5 to 7 seconds, give the person a breath of air. And then when they come around, they're going to be really confused, And there's 2 possible scenarios. One is that they're going to be very happy but they won't express it right away because, like, what just happened? I know I did my drugs, and it's going to be very cloudy for them. So you're going to want to talk to them, explain what just happened. You overdosed. We shot you with naloxone. You're going to be okay. Depending on what the person did, if it were fentanyl, for instance, you probably would need the second one. And it's really important to call 911 because with some of the new designer drugs, as the minister referred to, we don't know how strong they are. And it's always, always important to call help to try and keep the person from passing away.